It's an issue that's percolated among Democrats for years, and as we get closer to the 2020 elections, it's a term you can expect to hear more and more often.
The future of this country rests with Medicare for All.
That's what Medicare for All is all about.
I support Senator Sanders' Medicare for All bill.
I am proud to stand with my colleagues and friends and support Medicare for All.
That's right. Senators Elizabeth Warren, Kirsten Gillibrand, Kamala Harris, and Cory Booker all sign on to Bernie Sanders' 2017 Medicare for All bill. I know you didn't see Booker there. 2 years before they began their own presidential runs. And now Medicare for All is sure to play a big role as we head into the campaign season, especially if this guy has anything to say about it.
Their plan is called Medicare for All, except they have no money. But it's really Medicare for none.
Of course, Medicare for All is divisive, and while politicians can debate whether or not it would actually result in better coverage and lower health care prices, there's no debating the facts, at least the ones outlined in the Senator Sanders bill. A new single-payer health care system the government pays with a wide range of coverage, including hospital visits, primary and maternity care, medical devices, lab services, vision and dental benefits, with zero costs out of pocket except for prescription drugs. Taxpayer funding would replace premium payments. The plan would bar employers from offering competing plans and transfer current Medicare and Medicaid enrollees over, allowing just the Veterans Affairs Health System and Indian Health Services to continue operating as is. It would do it all over a 4-year transition period. It's an ambitious overhaul, but is it feasible, technically or politically? Joining me now are two of the most qualified people in the country to answer those questions. The former head of Medicare and Medicaid for Barack Obama, Dr. Donald Berwick. Good to see you, Don. Thanks for being here. Jonathan Gruber is one of the architects of the Affordable Care Act and Romney-Care. John, it's good to see you as well. Before we get to solutions, Don, can we try to identify the problem? What are the major failures you think health care reform has to address in the country?
We're still leaving a lot of people out, and of course, from the Trump administration, we're backpedaling. There are millions of people losing coverage now. That's really sad. But even if we fully implemented the Affordable Care Act, there'd still be about nearly 20 million people who don't have coverage. We need to solve that. And the basics here are that costs are still out of control, and we need to do something to help make sure that the money goes to help people instead of getting absorbed in complexity and fragments that are consequent on the payment system we have.
Coverage and costs. You agree with those two
Coverage
items?
and costs are where it's at. As Don said, we're backsliding on coverage, and coverage makes cost makes coverage look easy. Coverage is about spending money. That's the easy part. Cost is about saving money. That's the hard part.
Okay, so why is Medicare for All the answer? You campaigned for governor on that platform.
I
did. You not?
I did. I didn't start out. 3 months into my campaign, I decided to adopt it because I was looking at the state budget. I care deeply about important infrastructures in this state, housing, transportation, criminal justice reform. There's no money unless we're going to raise taxes to an unacceptable level. We can't do what we need for people. The money's being confiscated by health care costs, which are just out of control. And I know from 40 years of work on health care quality that a lot of that is waste, and we need simplification. We need to be able to get really clear about buying exactly what we want.
So is Medicare, is the primary argument, you've said it I think now twice, is it the lower administrative costs in, what is it, in 1+% as opposed to 10+% with private delivery?
More or less. Medicare is probably 2-3% if you add up all the costs. The private sector is 15% under statute right now, but even that's undercounting. So there's a lot of money on the table. It's more than administrative costs. That's very big, but it's also a chance to make the system begin to make sense so that we're actually giving people much better care.
And I assume you're talking about what those candidates are talking about, a federal system, because even though you said you ultimately came around on the state level, Vermont was, I would say, a disaster. You had a governor who sponsored it and then a governor himself who ended it, saying the cost on a state basis was just prohibitive.
Well, John can say more about the state level possibilities. It could be done at a state level, but you need a friendly federal government that's giving the state the waivers it needs. You need to meld Medicare and Medicaid together. You need to do something about the ERISA exemptions, which take a whole bunch of health insurance and make it inaccessible to the state. It could be fixed. Vermont failed more because of the shift of the payments stream. You're taking private payment and moving it into a public channel, and that is a tax. And
well, that's exactly what's going on on the federal level, though, too,
exactly right. There's a messaging issue here. It's lower cost, I think. I think the cost would go down, but it would be what you're now paying through private channels is a whole bunch of money, and that amount goes down, I think, if you would choose the single-payer option.
You're not convinced, are you?
No, I think everything Don said is true, and I think, but the experience of Vermont teaches us the problem, which Don emphasized. So I worked and did the numbers for the state of Vermont, and the bottom line was great. The state of Vermont would have saved at least 10% on their health care spending through administrative savings only. But in order to fund that, they would have had to double the entire amount of taxes collected by the state of Vermont. Now, how can those two things be true? Because employers would have been paying a lot less for insurance, and wages would have gone up. Essentially, insurance in America today is funded by an implicit tax. So GBH doesn't give you health insurance out of the goodness of their heart. They give you health insurance because otherwise you'd go work for someone else. But what they do is they pay you less as a result. So if you instead got health insurance from the federal government, GBH would pay you more. That's great. But the problem is people see the tax. They don't see the wage. They don't believe the wage increase is coming.
So
And
is
that's
your
the challenge.
objection on the merits as to which is the best way to provide health care to people in this country, or is it because you don't believe it's politically feasible?
I once again, I am not against it all in principle, Medicare for All. I just think that
Are you
there
for it in principle?
Honestly, here's the thing. I haven't made up my mind because I feel like I don't have to, and here's why. Because there's 3 political hurdles we have to get over. One is one we just talked about, replacing implicit tax with an explicit tax. 2 is the fact that 160 million Americans have employer-sponsored insurance, and they don't want to give it up. By and large, they're satisfied with it. You saw the hubbub over 1 million people getting slightly less generous individual insurance under Obamacare. Imagine telling 160 million people. And third, we have a $900 billion private health insurance industry that's going to fight this. So my view of Medicare for All is I have a limited intellectual bandwidth. I want to spend it on things that might actually happen in the near term. I just don't see how we get past those hurdles.
Can we get past those hurdles?
I would have said probably not a year ago. Now I'm starting to change my mind.
What caused you to change your mind?
The public rhetoric and the appearance of leaders who are finally speaking out about this. There's a long educational process here, Jim. We're going to have the public, help the public understand what's in it for them. What's in it for them is money and better care.
I want to talk about the education process in well, let's talk about it now for a second. The Affordable Care, I mentioned this to John, I think, yesterday when we were talking. The Affordable Care Act, when Marjorie Egan and I used to take calls in the early days when it was just proposed, people either fervently opposed or supported it, and I think it's fair to say neither of them had any idea what they were talking about. All they knew was the one thing that wasn't true is they all knew something about death panels. So why do you assume in this kind of charged environment that we, America, could be educated to the point where we wouldn't be scared off by all of the negative rhetoric?
Well, look what's happened with the Affordable Care Act. Although the administration's undercutting it, the public's now supporting it. They understand what they get with it. They get more security financially. They get health care reform that they want. They're understanding the benefits. I think it'd be very hard to repeal the Affordable Care Act by referendum today. People are supporting it.
There's one other thing, John, before you go ahead. John just mentioned a minute ago the whole notion about replacing. I looked at a lot of the polling data, replacing private insurance. In most recent polls, a majority of Americans support Medicare for All. And in fact, a majority of Republicans in some polls support Medicare for All. However, as soon as you add, and it's going to replace, if it were to replace your private insurance policies, those numbers drop precipitously. So is the solution to not eliminate private insurance and make it a complement, or do you have to go all 9 yards?
Well, you're seeing some experiments now. The recent rhetoric, in fact, yesterday even more, is about Medicare for some, expanding Medicare, making a buy-in possible. So if you want your private option, you can have it, or you can buy Medicare if you want. I think that would be very attractive for people to be able to buy into Medicare. But you couldn't take the Medicare population today and say, oh, by the way, Medicare's over, we're going to move you over to commercial coverage. They wouldn't accept it. And that means that the public can understand the value of this kind of simplification.
Do you believe that?
I think Medicare for some is a great slogan. It's not nearly as catchy, but take what Don just said.
As a transitional thing, you mean?
But listen, what Don just says is exactly right. The Affordable Care Act, people like once they've seen it. What Medicare for some would allow is to sort of put the toe in the water, say it's not a socialist takeover of America. We've got some people getting Medicare, and look how things have gotten better. Now let's talk about expanding it, maybe by age, maybe by income group. But I think if you go for the wholesale replacement, there's a lot of theoretical advantages. I think politically, you're just going to end up, you're basically letting the perfect be the enemy of the good.
Well, you mentioned socialism. We talked about this the other day, too. It was clear to me after Donald Trump used the term in El Paso that that's the Donald Trump 2020 campaign. 70% marginal tax rates, Medicare for all. And you say the public can be educated. Why don't they know that the programs they love, public schools, Medicare, Social Security, are all that same horrible socialism that they recoil from?
Well, the opponents will use whatever tactics they can to help obfuscate and make things confusing to the public here. For example, when I ran for governor on the state level Medicare for All, I found a lot of people thought that meant a state takeover of delivery of care, that all our hospitals, all our doctors become government employees. That's not what this is about. This is only about the financing channels, making it simpler and more accountable through public channels.
Does Medicare for All quickly help a Democrat running against Donald Trump in 2020 or hurt him or her?
It helps if they're vague. It helps if they don't do what Kamala Harris did and say things like, oh, yeah, we're going to get rid of private health insurance.
What?
It helps if they explain that you can get there in steps, not jump there all at
once. How about you? Help or hurt?
I think it'll help. I think the public knows that the system isn't working for them. It's not working on their behalf, not as a whole. And we need change, and we need leaders who are going to speak out about that.
I hope you'll come back and continue the education process. John Gruber, good to see you. Don Berwick,
nice to see you, Jim.
Really appreciate both of you.